So, not long ago, a patient was featured in the news because she had a baby in the United States from after a uterine transplant. She was born without a uterus. It's a wonderful story, but I'm not sure I'm excited about it. I'm usually excited about advances in our field, but this one involves a really complicated situation. Someone who's alive has to donate her uterus. Now, lots of women say they're willing to donate a uterus, but they don't really know that they're getting to a risky procedure. You can't just have a hysterectomy. Not only does the uterus need to come out, but the blood vessels that supply the uterus have to come out. They have to be dissected. And so this involves a complicated surgical procedure. It can't be done laparoscopically, of course. And there's risk of injury to the bowel and bladder and blood vessels. So then the woman who wants to conceive can have the uterus transplanted, and it's actually reasonably safe for her because she can have immune suppressing drugs for just the time it takes to get pregnant, have the baby, and then probably have the uterus taken out again because she's going to have immune response or have to stay on immune suppressant drugs for a long period of time. So it's the cost, if you just look at how much it would cost to do this, it's got to be astronomical. No one has published any data on how much it would cost, and right now it's only done in trials. In other words, you can't just go get it done at your local reproductive endocrinologist. You've got to enter into one of these trials. I worry about issues like, is the blood supply to the uterus going to be adequate? The first baby, incidentally, that was born from this in Europe was small for dates. After we've done 100 of these, are we going to find that 20% of the babies are small for dates because they didn't get enough blood? It's just, I guess the best way to put it is, it's still an open question. Is this going too far? Or should women who are born without a uterus, or who have a hysterectomy and still want to have a baby, should they use a surrogate? Because a surrogate is an established way of having a baby in that situation, and it's actually less expensive, most likely, and it doesn't put the donor at risk.